Welcome back to the program. This is Good Morning Kenya. I'm Dorina Range. If you're just joining us, time for our first conversation this morning. And being Health Tuesday, you know, we want to talk a bit deeper about matters to do with health. And this morning, our focus is going to be simply on affordable healthcare. That still remains one of the president's big four agenda. But how far has it come? And perhaps the gaps that are yet to be filled. What can we do, or what are Medex even doing to fill those gaps? On set this morning, I'm joined by Prishita Vora.
Absolutely.
I got it right.
Yes, you did.
Who's the CEO of White Oak Medical Center.
That's right.
Prishita, before we go to that bit of affordable healthcare, because that's going to take a bigger chunk of our conversation, let's start with White Oak Medical Center, because the kind of services you're offering there are really quite beneficial, also in regards to what we talk about, some of these diseases that especially a good number of Kenyans are getting as it pertains to matters lifestyle kind of diseases. Let's start from that bit.
So White Oak Medical Center is an outpatient medical center located in Spring Valley Business Park in Westlands. We're an outpatient center. We offer doctor's consultation, lab, pharmacy, wellness packages, immunization, vaccination, procedure rooms, emergency room, ultrasound. We have specialty consultations, and we're constantly trying to bring in new and innovative healthcare ideas. That way it's affordable to patients out there, and people, when they come in, and they leave with their dignity and their respect intact. That's always been our greatest motto. We are a very clean, sterilized center constantly. So I know people have a lot of fear when they go into hospitals thinking, oh my God, I'm going to probably walk out with corona.
Yeah.
But here, when you walk in and when you walk out, you're like, yeah, I still feel very healthy. And obviously it's affordable. That was one of my biggest aspects.
All right. You've mentioned something which I'd want us to just delve in a bit, because anytime again also we talk about the health kind of system, we're always trying to think what is new, what is the new innovation, and you've talked a bit about that. Tell us a bit about this kind of innovations, you know, that perhaps are there in the kind of health system.
So I studied in America, worked there for a bit as well. And in America, there's always payment plans when it comes to healthcare. So when I came into Kenya and I started inquiring about payment plans, because I get a lot of patients asking, I can't afford this, do you have any way to finance it? So it got me thinking, why can't we have the same system in Kenya? So I approached a lot of microfinance companies, a lot of insurance companies, and I always came back with closed doors. Or they'd be like, whoa, we've never heard of something like this here, maybe we could look into it. So now I finally found two companies that I'm possibly going to close my ties into, in which they'll be able to give payment plans to patients to afford their healthcare. So payment plans could be over 6 to 12 months, in which you, instead of buying yourself a TV, go get yourself a full body healthcare checkup, or make your lives better, get your preventive healthcare done and right. So that's what we're trying to get into.
All right. So then how does this payment plan works, and does it cater for, you know, common Kenyans? Because again, anytime we talk about this kind of healthcare and affordable healthcare, we are always trying to target the common Kenyan. Right now, as it shows, only 4 out of 5 Kenyans who are regarded as the poorest have this universal health kind of coverage. So really, how does this plan work?
So basically, it's just like regular microfinancing. You would contact the company, and one of the companies I'm talking to, within an hour you'll be able to get your loan. So they'll never give you money in hand, but instead they'll give you a certain amount that you can use, however much you apply for it. So then you'd come into my center and say, look, I have this much approved money. Can I use it towards a wellness checkup? Can I use it towards a doctor or a metabolic balance program, vice versa? And then you would use it, and then it's up to you how long you take to pay off that loan. So if you confirm it with the company, like within 6 months to a year, you want to pay off that loan, so it depends. And the interest rate is very low. It's even lower than going to a bank and getting a loan for yourself. So that way it is affordable.
All right. Prishita, do you think that that's one of the major problems that we have? Because, I mean, we can keep talking about affordable healthcare, and we can keep talking about even this different payments plan that Kenyans perhaps might need to get into to afford and accord better healthcare services for themselves. But you've mentioned again something, and this in regards to how a good number of Kenyans might invest in even wanting to buy a car, wanting to buy a TV, and they can get into different kind of plans just for that. But we do not have this kind of mindset when it comes to our healthcare or our health. We don't take it with much regard as it is for material things.
Absolutely. And it's quite heartbreaking to see, like you said, you can buy a car, pay it off over 5 years or even 24 months.
And you're very comfortable with that.
Yeah, very. But here you can't shell in like a good 10 to 15 or something K towards preventive medicine. So you could make sure that tomorrow morning you don't end up in the emergency room. You're not selling a kidney just to afford a good health care, or you're paying off fees. And it's so heartbreaking to see even parents come in and say, hey, my mom is really sick, but they can't afford the healthcare in the hospitals these days. So imagine now having a payment plan where your parents can walk in very confidently into our center and say, look, my child needs help, please assist. Before that, they would be shy away from it. They would go through other means of healthcare instead of going into a hospital just because they're scared that they will not be able to afford excellent healthcare, which is their right as a Kenyan, as a human being. So here we are trying to bring new and innovative ideas so they could do that.
All right. And just going by your perspective also as a doctor, perhaps from the people that you've interacted with, what do you think the problem is? Because again, when we talk about this affordable healthcare, I really don't want us to target so much the government, because I mean, it still boils down to you as an individual.
Absolutely.
There's just so much that the government can do. What do you think is the problem, especially with most Kenyans, that we become so easy in investing in other things, but we really do not take key interest in investing in our health? Is it our thinking? Is it our lifestyle? Why do we just take our health as when I get sick is when I'll actually go to hospital?
That's why I keep I enforce preventive medicine so much. Doing a full body checkup once a year is so important, so you don't ever get to a point where you're going into an emergency room, right? You don't ever get to a point where you're like, shit, now I need money, I need to changa money from my family, friends around to get there. And then we're so vested in our lifestyle into making sure we have the finest of all things. Why can't we just make sure we have the finest of all things in terms of our health as well, which is basically our life support system. That's our money.
Yeah.
Right.
All right. Then let's talk a bit also about the weight loss program.
Metabolic balance.
Yes.
So Metabolic balance is a weight loss program, also not just dedicated towards weight loss, but it also helps people with diabetes, with uric acid. I also have patients that were so tiny and now they're bodybuilders.
They have muscles also.
Full-blown muscle men. So it actually helps regulate your hormones. And for some people, if you want to go towards that way, metabolic balance, the side effect is weight loss, which is excellent, right? Because you're eating healthy, you've had a whole new sense of lifestyle, yet you're losing weight. Things like keto, intermittent fasting, all of those are fantastic, but for the short run. But metabolic balance is a complete lifestyle changing program permanently. It's not like it's a diet. We're not going to give you any shakes or spills or anything like that just for a quick temporary loss. So it helps permanently change the way you are. I myself have lost a good 10 kgs. I had to experiment on myself first before I give it to patients out there. Always in life. It's important because if I can vouch for it, and if I can do it, I know patients will be able to do the same as well.
You speak so much, you speak so passionately about this kind of program, the weight loss kind of program, which is also part of having good kind of healthcare.
Absolutely.
So that's what we're talking about anyway. What is the drive and the passion about it?
I love when people walk out of my doors happy, healthy, and have a new renounced sense of life. Right? That's the whole point of having a medical center. Let's not just bring in the sick, let's also bring in the healthy and make their lives better. So yes, as a medical center, I would like to create revenue, but I don't want to keep constantly seeing sick people out my doors. Right? I want them to keep coming back because they're constantly more healthier and they want to keep feeling that same way as well. So metabolic balance does that. We make sure your hormones are regulated, your lifestyle is better, you're feeling better. People with mental illness as well, mental health issues, they've come in and they've walked out and said, hey, I don't need my depression pills anymore, which is excellent. Right? That for me as a person is a huge win. People come in and they're like, insulin, I'm taking half of it now, which is great. So that's the point of metabolic balance. That's also a holistic point of White Oak Medical Center as well, not just for the sick.
Wow, so it shows the progress therein.
Absolutely.
Okay.
And the journey with the metabolic patient is not just one-off, yeah? I'm with you until we reach your goal. That could be 6 months to a year. And keep going if you want to. And constantly being in touch with them, consultations, making sure they stay on track is also very, very important. I'm a very irritating person when it comes to my patients. I will make sure we get you better before you walk out of my doors officially.
We get to the goal. Right. And Prishita, I think it was important for us to just talk a bit about the weight loss, because again, when you talk about affordable healthcare and good health, that in itself is one of the entities.
Absolutely. And people put in so much money constantly into weight loss, and they'll keep seeing doctors about it as well. But now imagine you're going through a whole program which you can actually get a payment plan off as well, pay off like 6 or 10K a month, right, towards a full lifestyle change, and you're feeling better
and
overall.
You're good.
And you look good.
And you do away with the lifestyle diseases
Absolutely.
as well.
Now imagine looking in the mirror and you feeling so confident with yourself, and you have this renowned sense of life and love and everything about you.
All right. Okay. Again, there's another factor, because anytime we speak of affordable healthcare, we are always thinking finances.
No.
This just has to do with money, maybe how much I need to pay or how much I need to save. But you are telling me it's holistic.
It is.
Explain to us.
So what we're also trying to do is, everybody wants to travel to India or abroad for healthcare.
For checkups.
For checkups, right? And they keep thinking it's excellent out there. The doctors over there are super specialists. So what we're also trying to do is bring that to Kenya, right? So my center will soon be partnering with a huge institution in India to provide telemedicine with the super specialist doctors in India. So we'll have specific dedicated days, like say for example Monday will be neurology. We'll give you a whole dedicated hour, not just 10-15 minutes like you have with the doctors in Kenya. I'm talking about a full hour, 35 to 40 minutes with a doctor. You're sitting down one-on-one in a room with them, and you're telling them your whole history, and you're getting full treatment done with yourself for an excellent affordable price. We all know super specialist consultations over here is an arm and a leg. That's not light. But imagine now seeing a doctor in India within the comfort of our own room, getting the treatment that you need at that affordable rate.
All right. So just doing away with the finances or the money bit, it's also in the question of services.
Absolutely.
Okay.
Now, you see, India, actually, I want to prosper the doctors here, but India has super specialist doctors that are within this profession for more than 30-35 years. So we've made sure we target those doctors that are very well knowledgeable. So when they come into the center, when you come in and bring your family, you know you're getting the treatment right. So again, like you just said, not about the affordable part, but it's also about healthcare with dignity, with respect, with the whole holistic approach when it comes to it.
And Prishita, I'd like you to talk to us a bit about that respect bit, because anytime we talk about that kind of healthcare, we don't think respect is part of good healthcare or even affordable healthcare. Because the way we are saying is that some Kenyans are even fearing to go to hospital, especially during this COVID-19. And our latest research shows that good number of Kenyans have died due to COVID-19, not because of the disease itself per se, but also because they were scared of going to hospital. And not because they didn't have also the money per se, but they just were scared.
And it's that same instilled fear that we had within ourselves as well. Like, we won't make my mother-in-law go to the hospital. If she's sick, we're like, no. Before I had White Oak. We're like, let's go find the nearest doctor that can come home. So we just didn't want to expose her. Because every time you think hospitals, you think, oh my God, I'll probably walk out with corona. Right? Or with any other diseases out there. But when it comes to the respect, when it comes to the dignity, the reason why we built White Oak is every patient that walks in through the doors will get their specific time and dedication set to them. Sometimes we're on appointment basis. Yes, we also take walk-ins, but social distancing is very well maintained. Sterilization is important. After every single patient we're done seeing, we sterilize the whole area. You literally see my doctor going like a crazy person with the little machine, just to make sure that there's no next contamination gone there. It's sad to say, we learnt about this in university as well, that majority of the diseases that you get are within the hospital itself.
So that is a factor. That's why most people would be scared. Again, brings the whole aspect of it's not always about finances. Anytime we talk about affordable healthcare, there's more to it than just the money.
Hygiene is so important. Cleanliness is so important. Sterilizing the place is so important to make sure that the next person does not get sick just based coming from my center alone. Otherwise, I feel very disgraced as a medical center if I get a patient complain, hey, I possibly got COVID from yours. So things like that we have to avoid. We have to keep at the protocols. We have maintained certain ways in our center to make sure every single staff knows how to make sure that even if they bring in their own family tomorrow morning to my medical center, they will not be scared. They will not be apprehensive about the treatment as well. That's very important.
What are you doing in your capacity as a doctor? Because you've mentioned again something very important just from that research that you've talked about there, that it shows that bigger chunk of the diseases that people get is a result of even visiting these hospitals, which again brings that whole aspect of fear, which is just what we've talked about. But what are you doing in your capacity to do away with that notion so that we can actually get to this affordable healthcare that we're talking about?
When you walk into my center, the first thing is let's sterilize your hands. Let's clean your hands. Let's sanitize it. Then you will see guns everywhere. Not guns, but like sterilization guns everywhere. So you know, okay, this center is clean. Constantly, my staff are making sure every surface out there is good. So even if you put your hands there, after you're done, they'll scrub it down, just so we make sure the next person cannot get contaminated. Certain protocols like that are set in my center for that. So we ensure of that.
To ensure that. Okay, then do you think that maybe more needs to be done in terms of even proper sensitization? Because the way we're talking about even that latest research, which shows that a good number of Kenyans have died out of COVID-19, not because they didn't quite have the money to go to hospital or, you know, just having that kind of finances, but good number is it was because of fear per se. So what more do you think needs to be done in terms of proper sensitization? Because at the end of the day, we need to achieve this goal. We need to actually get to achieving that affordable healthcare, and for all Kenyans.
Absolutely, and get to zero COVID cases in
yes,
Kenya
or even
as well.
zero diabetes cases.
Absolutely. Again, awareness, prevention, education, all of those that we keep hearing people talk about are so very important. Even as a medical center, we're trying to create awareness all the time. We keep doing Zoom calls. We keep doing live seminars, so people can even ask questions to the doctors without having to need the pay for consultation. We keep trying to educate. We're also trying to do a huge health fair in the center, in which will be everything related to health, because health again is not just medical. Health is also wealth, health is also prevention, health is also safety. So we're trying to go about with a huge health fair that will help educate patients even more of that as well.
All right. Then also, what do you think needs to be done to actually make healthcare in itself more affordable?
I would keep saying this: affordable payment plans, lowering our pricing so patients can afford it, getting help with countries abroad as well. Yes, we love to do Kenya, but I won't lie to myself. Being in Kenya, affording the reagents and everything is a lot more expensive, right? So that's why companies like me partner with India, where they have huge volumes, huge numbers. That way, when I'm sending the samples out to them, it's affordable for the local wana inchi, compared to doing that entire wellness checkup in-house. So yes, we need to get help of countries around us. That's why they're there. That's why we're a united world. But affordable healthcare is also saving costs, saving money, giving them the right respect, the treatment. Cleanliness is so important.
All right. Again, a bit about health insurance, because also we, at least as of now, we know that amongst the poorest of Kenyans, only 3% have actually health insurance.
It's true.
How are we doing as a country? Because if you can talk about the amongst the poorest of Kenyans, it's only 3% who actually have this kind of insurance. Yet we keep talking about we need to make health more universal. We need to make health more affordable. Then how really are we doing as a country?
Is NHIF even helping? Sorry about that.
You can tell us.
Honestly, trying to onboard insurances myself, I see it's a struggle. And whenever I keep going to insurances saying, look, we have a huge demand for people around us, want to keep onboarding insurances so we can assist them as well, but keep being closed out. So like I told you, instead of hitting my head through insurance side, I was like, let me try this route. Let me try being my own form of an insurance, right? Giving the affordable healthcare, giving the payment plans to patients. So that way, if they're not paying an arm and a leg, trying to pay the premium for insurances, instead they can come to the center and they can afford their healthcare while paying for it every single month. So even if you have insurance or if you don't, come into White Oak. We can help you get your treatment and healthcare that you need.
So then do you think actually that is something that's workable? I mean, again, let's just stick a bit about with the insurance bit, because from the statistics and those numbers, they're really quite low. If we talk about 3% and we talk about how health is important and that vital, maybe from your perspective, do you think that this is a number that can go up in terms of people acquiring either the health insurance or different various payments plan to help in how they can take good care of their health?
I would think so. Like, I would think that if healthcare insurances onboard such payment plans for their patients, instead of paying out a chunk just in the start, that would make patients' lives easier, make it more affordable to access good healthcare around them as well. Like, for example, if I had to pay for insurance, I know I have to pay a premium straight up, right? And then it's every single year. But now imagine if you had an insurance company, they said, look, pay us this certain amount every single month and you can get this high premium with this much outpatient, with this much inpatient. As a person working with a minimum wage salary, I would be able to afford that for myself and for my family. That way I won't be scared. And I'm actually really shocked to hear that only 3% of Kenyans have affordable healthcare. I actually thought the number was larger.
The poorest.
Absolutely.
Yeah.
And I honestly thought the numbers were larger because our local healthcare insurance is much more affordable, at least that's what I had thought of, compared to international insurances such as Aetna, Bupa, Cigna, etc. So really shocked to hear that. And maybe that's why places like America can afford to insure all their citizens. And majority of them, like I was a student, so obviously I was not qualified for any insurance there. But the system of payment plans helped me survive 5 to 10 years of my life there. Because I knew in the back of my head, if I got sick, I would just enter a hospital and I'd be paying, back in America days, like $100 to $200 every single month for the treatment that I needed. But now coming to Kenya, I was shocked. And it's kind of like a culture shock being brought in Kenya. Like it's a shock that, oh my God, my own country and I won't be able to afford good healthcare.
But also, I mean, for me, I think, no, sorry, I don't know if you think that way. That does this then go about goes into creation of awareness, proper sensitization, the aspect of regarding our health as something important and vital, and not just having to visit hospitals when we feel we are sick or when actually we need services from a doctor.
Absolutely, preventive healthcare is so important. So you don't ever visit a doctor just when you're sick. Genetic testing is something that I'm trying to get into. We're almost done with it. That way we will be able to tell you, hey, if you're prone to diabetes, blood pressure, Alzheimer's, cancers, tumors, any of those, we'll be able to tell you way beforehand. We won't be able to tell you if your babies will be prone to that when they grow up. So now imagine you finding out, I'm pregnant, my baby is 1 month old now, and I'll be able to find out all the predisposing conditions that they'll be exposed to. That way, from now, I can ensure that I can make their lives much better, much healthier, try to avoid them into all the ways that they'll be predisposed to in terms of, even if it's diabetes, make sure the sugar content they take is much lower. Because I know genetically wise, they might get it, right? So preventive medicine is so important. So we make sure we don't ever get to that end stage, to those later dreadful stages.
Okay, and you know, just talking about preventive medicine and preventive care, it makes me feel that we need to touch base on that a bit, because again, going back to our center of conversation, affordable healthcare, and like I mentioned earlier, that anytime we talk about such kind of healthcare, we're always thinking finances, and I'm so sure most of us don't think of how important preventive care is also a prerequisite to affordable healthcare. And this involves the kind of foods we eat, how we live, even this kind of body exercises that we do.
It's true. One of the plans that I'm almost going to be talking about, like, let me just let you know about it, we've actually signed them on. We'll actually take your stool sample, and based on your stool sample, we'll be able to tell you what foods are superfoods for you, what foods are good for you, what foods are bad for you, and what foods you should avoid. And we'll actually reset your entire system. So you never possibly would get IBS or bloating or gas or diarrhea or constipation. Sometimes, I don't know if you've felt it, that for my husband, if he eats red meat, I know he's messed. For me, if I eat cabbage, I know I'm good. So certain foods we don't know of until it's actually physically laid out there, right? So that way we can reset your gut, we can reset your system based on the plan alone itself, based on this. And again, like I told you, affordable payment plans, very important. So that way we make sure you don't get any other health problems out there. Just preventive healthcare.
Wow, I really would have loved us to talk a bit about that preventive kind of care and preventive medicine, since it just came up. Because like I was saying, when you talk about affordable healthcare, we really don't think about that. And you're so quick to say the government needs to do that, the government needs to roll out UHC, we need to actually reduce on payments, but we really think about preventive measures.
Absolutely.
But I'm being informed that we are out of time.
That's
so
okay. That's okay.
If perhaps we'll pick it up another day. But just as you conclude, maybe what would you say to a good number of Kenyans, especially as it pertains to this preventive care and preventive medicine, as you conclude? I
would say, please ask questions. Please ask how you can afford good healthcare. Go to your local institutions, ask them, hey, do you have a payment plan? Can I get access to my wellness checkup? How can I pay for it over periods of time? The more Kenyans push for it, the more we can actually make this norm of payment plans in every single institution that's out there.
A question of being responsible.
Absolutely. take matters of your own health into your own hands, please. Please.
Thank you so much
No
for your
problem.
time.
Thank
and also
you
at least for making us understand that indeed affordable healthcare is not only about finances and money, it's a holistic kind of system. All right, and that's how we bring the conversation to a close. That has been Prishita Vora, the CEO of White Oak Medical Center, talking to us about affordable healthcare. When we return, plenty more of Good Morning Kenya. Stay with us.